So I have a question to really start with. There's been so much amazing, inspirational, progressive information shared this weekend. And I really love what Peter's doing. I think this is one of the most valuable events for doctors who are really moving into a more evolved practice, where we own medicine, where we reclaim medicine as our own, and we make choices from a different space of awareness. And as Dr. Osborne shared, I've really had quite an amazing journey in my career in medicine, going from, trained at an osteopathic medical school, and I became an emergency medicine doctor, which was like the opposite end of the spectrum. I trained at a level 1 trauma center at Grady Hospital at Emory University in Atlanta. And everyone would kind of say, you had this idea of doing this osteopathic thing, and now this is what you're doing. And it really was a fit for various reasons. And after 2.5 years of practicing full-time ER, I was like, where's my life? This is not how it was meant to go. What am I going to do? And I've always just really naturally connected in my body for awareness, for answers, for insight. And it had been years before where I saw Joan Borisenko speak on stage. She's an MD from Harvard MindBody Institute. And I was so blown away. I was at the Yankee Dental Conference with my dad, who's an oral surgeon, and would speak at that event every year. And this one year, we saw this mind-body medicine person. And we went in, and everyone was completely captivated by what she was saying. And you couldn't really put your finger on what it was really about, but you knew it was like the most amazing progression of what we were introducing to medicine. And then the next year, they had her back again, and there was an even bigger room. And then the next year, they had her back again, and it was a room like probably 3 times the size of this room. And it was standing room only. And what I received from that was doctors are starving for this. And it moved something inside me that just knew this was a big part of what I would be doing in my career. So the question I have for you is, what is your number one tool as a doctor? And we've learned about all of the amazing, enzyme pathways and supplements that can be used, and how we can correct DNA, discrepancies, and what we can do to support our patients from a fitness standpoint. And so if you were to imagine, because everyone has a different kind of practice, a different kind of expertise, a different kind of passion, and the thing that you're really excited about, what is your greatest tool that you have? We have our stethoscope, we have a blood pressure cuff, we have a lot of ways of getting information from the patient's body that we can then interpret and make recommendations on and have some awareness and contribute. We have nutrition, supplements, medication, which is by far the number one thing most doctors are using to address the problems for their patients. So what would you say for yourself? So I want to sort of hear some shout outs about what your thoughts are on that. Food. What is it? Imagination. Awesome. What else? Communication. So what I've learned, and sort of always going back into my own inner wisdom and connecting with my body, I've always been a very energy sensitive person, and had, been able to use a lot more of my mental faculties and connect with my body's wisdom. And so as I've come through my career, even back in the ER with patients, bleeding, or you're putting a finger in the gunshot wound in the myocardium, or people who were scared and severe pain, was that I had a lot in my body, that my body could actually be a space that could assist them in healing. And so what does that mean? Well, your body's made of energy, and we all know from science that when we look at things under the electron microscope, and then we go even smaller and you look at the tiny little molecules and the subatomic parts, and then the electrons and the neutrons and the protons, and then we find that it's mostly empty space. and that nothing is static. Everything is constantly in motion, and everything is energy. And your body's energy, your cells are energy, your DNA are energy, your thoughts, ideas, emotions, it's all energy. And that is the thing that has the most powerful effect on your patient and what sets up a field, so to speak, so that your patient can heal. In fact, one of my mentors, Dr. Tudor Marinesco, do we have any osteopaths in this room? Because I'm a DO, and I kind of thought there might be some other ones here. It's something functional medicine will draw more open-minded doctors to. And Tudor Marinesco is an osteopathic doctor in California in a place called Ojai. And I had interviewed him a couple years back for a radio show I was doing. And we talked about this, that your presence can be the most powerful factor that allows your patients to heal. And he said, my husband was on there, we did it together, and my husband said, they say how you listen. You listen with your body, you listen with your presence. And that will open up the space for your patients to tell you exactly what's really going on, what's really wrong. And you've heard that probably in medical school. I heard it in medical school. If you listen deeply enough, your patients will tell you exactly what they need. And what Tudor said to that is that, and if you listen even more deeply, you will witness the healing experience right there. And that just resonated with me because I've seen this so many times, that I could create a space of healing for my patient that would not only bring up all the things to the surface that need to be fixed and all the things that were really the root cause, but that we could allow that to release and they could receive that level of healing. That's an energetic experience. So I want you just to connect you with this for yourselves, because we all have a body. So stand up for me. And just feel your feet on the floor. And start with your alignment. And you can balance yourself on the fronts of your feet, the backs of your feet, left side, right side, and get a little aligned, like in yoga class. Take a deep breath and close your eyes. And as you breathe, do the best you can to let your belly relax, let your shoulders relax. So the breath comes all the way through the body instead of just up in the chest. And with your eyes closed, slow your breathing and bring your awareness to the space around your body. So you can start with being aware of your body, maybe how it feels physically, how your feet feel on the floor. Start to relax some areas, maybe move your neck a little bit, and then just expand that. And I want you to feel what it feels like in the space around your body. And if you think you don't know, just imagine that if you did know, what would that awareness be? And so then consider that there are other people in the space around you. And for example, when you're in your practice, there's a patient in the space with you. And so just staying here, I want you to receive what's going on in the area beyond just around your body, but also involving these other bodies. And if you did know, what would that be like? And then I want you to play a little bit with moving yourself around. So if you were to rock yourself forward toward your toes, does your awareness of the space around you increase or decrease? You've engaged more muscles in your body to create tension. And so how many find that their awareness decreases? Raise up your hand. Yeah, okay, good. And then put your hand back down. And then rock yourself toward the back of your heels. So if you're in the center and then you rock toward the back, you're engaging your postural muscles, you're clenching down, your muscles are tightening. And again, do you feel your awareness decreases? Okay, then just relax back toward the center. And then I want you to clench your jaw slightly. Put your tongue on the roof of your mouth. And again, feel, does that connect you to the area and energy around you, or does it disconnect you? So again, show of hands, how many feel it disconnects you? Okay, so everybody, almost everybody. Okay, and then just come back to the center again. Take a deep breath, and you can go ahead and sit down. For all of us, we have varying amounts of how connected we are, and it's, changes patterns in your brain, changes the chemistry in your body when you relax your body and bring your awareness to the space around you. And it's something just like, we're talking about fitness, and you practice and you develop and you have that strength, your body can develop much greater awareness of what's happening in the space around you and what's happening in the space within your body. And for me, this is the number one most valuable skill that any of us can ever learn. Not only to be healthy and get ourselves out of fight or flight, because just shifting our breath, shifting our breathing, and shifting our awareness changes our brain pattern, changes the firing at the amygdala, and changes your chemistry. But it also allows you to receive infinite amounts of information, wisdom, through your body about what's needed in every moment, what's needed really for your patient, what's needed if you're in a conversation with your spouse that's going to land in a way that has things be, harmony instead of stress. When you're not connected with your body, you don't have access to any of that, and you have to live in your mind. And this is one of the biggest reasons why medicine has gone in the pretty disconnected direction we've gone in, where it's all about learning more, doing more, working harder, adding more and more treatments and modalities and supplements and stuff. And how many of you, every year, you learn more and more and more? I mean, we all are always learning. But if that's the only way we have to make our life work and to improve and to grow and to get better results for our patients, it's always going to be hard work. So what happens, these are all the problems that doctors are dealing with. We're burnt out, overwhelmed, too many hours, too much paperwork, so many things we're called to do and be that defeat us and deplete us. Insurance issues, malpractice issues, so much of a fear, the energy of fear in the field of medicine. The patient's in fear because they're scared, and the doctor's in fear because I might get in trouble here. There's all this legal stuff. Did I say the right thing? I need to make sure I don't say the wrong thing. Is this patient going to come back and attack me? I have to protect myself. So we're not in harmony. Developing business. Now it's like, okay, did this thing and I learned medicine. Now I have to learn, I want to be an entrepreneur, and I have to learn business, and I have to learn money, and I have to learn accounting. And that's enough to put you in the stress mode of fight or flight every single day. How do we go beyond that? So much of what we've been trying to do from the level of the mind, where we learn more, we understand more, we get more information, we develop more skill, we do more stuff, and then we can have a bigger impact or have a better result. And the premise of what I'm telling you is that when we get out of fight or flight, which to me doesn't just mean, I'm sweating and my heart's racing and I'm totally stressed and fighting the dragon. It's any level of stress will trigger your amygdala, will trigger you into increasing your cortisol levels, increasing your adrenaline, increasing your inflammation, blocking well-being. So, that's a scale. It's a continuum. Doesn't mean you're only those moments when you're in avid fear, but any moment where you're blocking full amounts of the life force coming through your body, complete relaxation and connection with abundance, connection with the world around you, receiving. And when we're in the mind, constantly trying to fix the problem, it drives us further into this state. And so we need to go beyond that. So we don't need to just know more. First of all, you can never learn everything that's in every medical textbook throughout the whole lifetime. But even if you did, what we know in medicine, what we actually know about the body is infinitely smaller than all the whole universe of what we don't know. And that's actually what we're called to be for our patients, is to access them to that infinite possibility beyond just, well, these are the things that can happen. You have this condition, and so you can't really get this result, but let's at least get you, where we can manage things. That's what most people are being told. You have autoimmune illness and you're going to have it for the rest of your life, but we have these medications and so you'll get by. Or you have fibromyalgia and I don't really know why you have pain, but let's try these supplements. And people are shooting in the dark because they're trying to operate from the mind. The mind will always be limited, incredibly limited, more than we can imagine. But your body and your ability to connect with the infinite field around you can access you to infinite wisdom. So how can that support you and what you're doing with your patient? In my practice, I mean, I did do this osteopathic practice, and it was, physical and some manipulation, and then there's some other mind-body stuff, but it was still fix my knee. I really want to get back out there and do my triathlon, or, I got this shoulder pain, or I'm having headaches. And I was showing up for like the $1 million moment, existential, change your life, and these people were showing up for fix my knee. And I'm like, this isn't going to work for me. I'm getting depleted by the day, and they're getting great results. I don't have to have surgery. I was going to have surgery. Now I don't have to have surgery. I couldn't do my triathlon. Now I'm doing my triathlon. I was living in Wellesley, Massachusetts, which is a little west of Boston. Everybody been to Boston? Because Boston that's where I grew up. It's a great place to visit as a tourist, too, because it's so much fun and so much, wisdom, culture, and, restaurants. And where I lived was right along the route of the Boston Marathon. And like everybody was a marathoner or a triathlete or, was in a running group. And so everyone had these sports-related injuries. So I opened Wellesley Sports Medicine. And I thought, okay, people don't necessarily know what is osteopathic medicine, but they get, the sports medicine, it's going to be something physical about the body and maybe pain. And it worked great to attract the person who wanted me to fix their knee. And it was the same thing someone had spoken up here yesterday about, when you lose your passion and now you get depleted from what you're doing, and eventually it's not going to really make that much of a difference for everyone else. And so within a couple of years, I was like, this is not going to be it for me. What the heck am I supposed to do now? And we all have our own personal evolution of how we allow who we really are to emerge. And what happens for our health is that the more we allow that, the greater vitality, the greater resilience, the anti-aging. Like, your body is a walking pharmacy. You can create every pharmaceutical, every chemical we've ever known, but you can do it in exactly the amounts that are in exactly the moments where it's most needed for you. So what activates that? What activates our ability to heal itself? And we have to get out of the mind. So your patients will you keep coming up with more. I'm going to learn more. I'm going to learn more. I'm going to do more. And they'll keep coming up with more complexity. And your patients are always a reflection of you. Your practice is a reflection of you. I once had one of my teachers ask us, who are you trying to save? You went into medicine for a reason, or if you're an assistant to a practice here, you were compelled to join that group for a reason and be part of that mission. Who are you trying to save? And so when we feel into that, we have a little more connection with our purpose, what we're really here for, what we're really doing. And the more we try to do it from the mind, this is what our practice looks like. There's more and more complexity, more and more stuff to figure out, and more stuff to learn, and more stuff to do. Who doesn't have a practice filled with patients with these obscure problems? And some acronyms you're like, I didn't even know that existed last year. There's a whole new name for what this person has. My mom used to say, you have Kimmy-itis. And everyone has their unique flavor of the illness. There isn't just this one label, and then these, 100 people have this, and these 20 people have that. Everyone has their own unique flavor. So you can see how we'll never get there with the mind, no matter how much we learn, in the way that actually helps really put that key in to unwind that problem for that particular patient. So Einstein tells us, and everyone's heard this, that problems cannot be solved at the same level of thinking where they were created. What does that really mean? We are energy, our bodies are energy, our patients are energy. And at the level of consciousness where the problem resides, every physical state of inflammation or disease or pain or tension has a matching energy state, whether it's an emotional state of anger or fear or frustration. And these can be subconscious little records that are playing that put the body in that state, because your body's listening to every thought you have. And that will have a corresponding brain activity pattern where the patient can't see their way out of a situation. And somewhere inside, they follow this little, like, Lissa Rankin calls it your inner pilot light. They follow that little pilot light of awareness, and they find a doctor who can actually do something that will make a difference. They find you. And they didn't hopefully find you out of that urgency, right, at the level of the problem. Oh my gosh, I'm afraid I'm going to die. I got to do this and I got to do that. Maybe I should go here. I've flown all over the world. And we all see patients who've done everything, and most of it comes from the state of fear, of urgency, of grasping. When they do make moves in the state, out of the state of inspiration, out of following their awareness, even if they're still in fear, those are the things that can make a difference because they have that openness to receive. So you can't solve the problem at the same level that created it, so it exists for us. If we stay in our own fight or flight, if I got to figure it out, I got to do better, what's my bottom line? How'd I do this year? How's my business doing? What's my online thing? Did I have 2,000 words in my blog? Oh my gosh, I got to do this. Who knows what the whole world of our own fears are, right? Because most of it's subconscious. But we can connect in our body, so we release that, we come into a different state, and then we do access higher awareness. And that's what creates new possibilities. Not a new supplement or the latest, treatment that we learned about, and just balancing the gut, biome. All of those are unbelievably valuable. But if we miss this, we can keep spinning our wheels trying to fix everybody's gut biome, and they still aren't getting better. What's going on? We need to go into a higher level of consciousness so we can easily, it's not work, we easily receive, like a download of awareness. And that allows us to create what's possible. So you don't have to figure it out. Most of the things we're doing in medicine, the studies have been done, aren't based on empirical science. It's the art of medicine. And this is one of the biggest things that's been lost in our culture today, is that medicine is an art and a science. It's primarily an art, and it's based in science. Now, not only have we totally gone over into the science piece, and maybe some of us still have an art, but we've forgotten that the art is meant to be the primary. Most of our choices for our patients are intuitive. Even when I was in emergency medicine, level 1 trauma center at Grady Hospital, and one of my attendings, trying to remember her last name, Cheryl Heron. Every single time we'd round, and we'd have like internal medicine interns, you'd have psychiatric intern, you'd have all the ER residents trying to teach them some ER that month, and you'd go patient to patient to patient. And they'd be like, well, Mr. Jones is a 59-year-old man who came in with chest pain. Well, stop. Sick or not sick? First thing I want to hear from you is sick or not sick? Is a patient sick or not sick? Because that defines the rest of the conversation. And for all of you who are rotating here this month, that's the one thing you're going to learn by the end of this rotation is to know immediately when you see that patient, sick or not sick. Well, you don't do that with your mind. ER physicians are some of the most intuitive physicians I've ever worked with. The first time I saw Doug Ander, he was an attending ER doc when I came for my first shift on a rotation at Grady Hospital. And there was so much going on. They have it's one of the busiest hospitals in the country. And there's, the beds are being pushed up and down the hall. They're lining all of the halls. And then the rooms are extra beds being shoved into the rooms. So much going on, so much chaos. And I was like, I'm going to get lost in here. And then there was Doug Ander with his white coat, just kind of looking around. And I looked at him, and he had awareness of the whole ward in every moment. He knew what's going on over there, what's going on over there, what's going on over there, what needs my attention when. And he was like the eye of the storm. And as soon as I saw that, I was like, this is the residency I'm going to do. I'm going to do an ER residency. And so Cheryl Heron would tell us, sick or not sick. And she wanted us to develop the ability to make that choice, to have that awareness. As soon as we saw the patient, as soon as you walk in that room, you're going to know. Now, all of us who finished that residency, we absolutely had that. And because it necessitated it, we had the awareness of everything going on in the whole ER, huge ER, at all times. So there weren't any surprises. And the first time I'd ever seen this happen is in a completely different setting. I was interviewing at University of New England College of Osteopathic Medicine, and I drove up there with my mom. I had no idea if I was going to get into medical school. And I was talking to one of the second-year students, and he said, if you really want to learn the art of osteopathy, you got to go, you'll learn stuff in the curriculum. You got to go to these weekend workshops. Like, what are these weekend workshops? Oh my gosh, these people can do these amazing things. They put their hands on people, and they can heal, and they can feel and sense things going on all over the place. And this one, doc, this one DO, he could feel what's going on the other side of the room. Hey, you're putting too much pressure. Hey, back off, you're focusing too hard. Because he had expanded his awareness out. And when I heard this, I was like, oh my gosh, I didn't know we could do that. These are things I didn't know we're capable of doing, but I want to do that. I want to know how to do that. If this person can do it, I can do it. And I learned to do amazing things. But I think we're overlooking that all of us are doing this to some degree, and all of us have the ability to do this to a greater degree. So practicing the art of medicine means, first of all, admitting it to yourself and allowing yourself to use your awareness, your inner knowing. 95% of the choices we make as physicians are based on this art, are based on our intuition. They're not based on, well, I read it somewhere in a study that we should do this one thing, and so I'm going to do this. No, we learn the science, of course, because it's going to guide us to use what we know for the benefit of our patient. So I want you to stand up again, and I want you to become aware for yourself of your most challenging patient. Now, if you don't have anything that really gets your goat in your practice, I want you to think of your most challenging person in your life. Like, who triggers you and what's going on? And if it's not a person in your practice, it's an aspect of your practice. So I want you to connect your relationship with that. It might be, oh my God, I don't have this online thing handled, and I need to do my online thing, and how am I going to do that? I'm already so overwhelmed. Whatever that is for you. Anybody have any specifics that you already know of? Just raise your hand if you got it. Okay, what do you have here? Okay, patient. That's the second one? Okay, so the first one was a patient is not doing well no matter what I do, and I can't find that magic key to open this up. And then the second one is the online stuff, which is like a whole other world. Anybody else? Yes? Okay, and what does that mean? How does that show up? That is perfect. Knowing when to surrender, and what he meant by that is to allow myself to be authentic in who I am instead of trying to figure it out and change it and do something to make a difference. Okay, that's huge for all of us. Okay, anybody else? Yeah? Okay, everybody have something? Yes? Okay, a patient who always pushes back on money at the front desk. Okay, so I want everyone to know that for whatever it is for you, there is always, one of our biggest things about being human, our natural state of health and vitality and vibrance is growth. You're either in growth or you're in stagnation. Growth feels amazing and live and vibrant and joyful, and stagnation feels like crap. Growth has a matching brain frequency, brain state, chemicals, oxytocin, health, anti-aging, your DNA gets repaired. All these magical things happen in your body. Stagnation, you are dying. You're aging faster. Your DNA is getting damaged. Your cortisol is going through the roof. Okay, so these are the two main states, and of course it's a continuum. So I want you to close your eyes here, and I want you to feel into your body. Take a few deep breaths. And as you do this, I want you to bring up that energy of that challenge, whether it's a person or it's an idea or it's this challenge that I've got to face. And I want you to breathe into your body and relax your body. And this is the true surrender, because you're going to move this energy in your body as you're moving into growth Everything that doesn't allow that level of expansion is going to come up. And it's going to come up in the form of that annoying patient that just says, no, no, I'm not paying you money, and you get triggered. Or this patient who's just not getting better, and somehow you're still making it about you. Whatever that is for you, I want you to breathe into that. Now, if you could feel the energy of that, because everything is energy, what would that energy feel like? Is it in your body? Is it maybe in the space around your body? If you could feel it with your body, I want you to become aware of where that energy resides. Maybe it's a heaviness in your chest. Maybe it's fluttering in your stomach. Maybe it's pressure over your shoulders or tension, pain. And keep just relaxing your face, relaxing your belly, relaxing your shoulders so your body breathes fully. That'll help you dramatically. And I want you to, if you did know where that energy is, imagine that energy in your body. Now, if it had a color, what color is that energy? You can resolve your patient's worst complaints in your body. What color is that energy if it had a color? What shape? If it had a shape, what would the shape be? And if you did know, what would you be aware of? So instead of trying to figure it out with your mind, allow it to be received from your body. Your body's connected with infinite wisdom. Good. So you've got some sense of this. Now, I want you to breathe into your body, into that area specifically. Bring all of your breath, stay relaxed. And let the breath come directly into that energy that is the problem, that energy that is the pain, that energy that is this impossible, unsolvable, whatever. And bring all of your breath, as best you can, right into that space. Good. And now I want you to bring breath like it's infinite amounts of breath for the rest of your life, and tell this energy you can have all the breath you need. You can have all the love you need. You can have all of me and all the energy you need. And just allow energy to flow like it's flowing through the top of your head, and it's flowing right out through your body into this area. You don't need to give this your energy. You can open to receive energy and let it come into this area that you've identified. So just let it flow through you. And now send love, as if you're telling this area, I love you, I love you, I love you. It's totally okay. You can receive everything you need right now. I feel you. I feel you've had a little tension in there. You take all the time you need. Good. And then keep breathing right into that particular area. Take 3 more breaths. And just staying with your eyes closed, raise your hand. How many of you are seeing a change? If you look to that energy again, how many does that energy look different than it did before? Okay, good. All right, almost everybody. Okay, you can put your hand down, take a last deep breath, and just tell this energy, thank you. I will continue to breathe you fully and completely and allow you to receive everything you need. Okay, and then open your eyes and have a seat. One of the main principles about energy is that anything that's true becomes strengthened when we give it our attention and love and space of breath, and anything that's false dissolves. How many of you saw that energy start to dissolve? Okay, great. Now, when you feel into the problem, I'll excuse you for an example. How does it feel now when you feel into those challenges? A little lighter, same, heavier? A little lighter. Yes. Yes. Awesome. So he's feeling really a big trigger and a lot of fasciculations going off and a lot of internal processes really intensely that triggered his nervous system. And that's kind of part of the fight or flight. So what happens? What is that? That means every time you think of that patient or that problem or your website or your business or your, oh my gosh, what if they have a problem that I can't solve? That relationship, it triggers you into fight or flight. Well, what happens in fight or flight is you become less capable, you access less wisdom, you're less connected with your awareness and your body's infinite source of of wisdom, and you're less capable. You actually enter into states where you like make dumb mistakes that you're like, why did I do that? That's not even me. If you're a tennis player and you're anxious about, oh my gosh, I hope I don't lose, I hope I don't lose. People talk about positive thinking. Your nervous system is listening. And then you mess it all up. You can't hit the ball right. It alters your proprioception. But if you do the opposite, you resolve the energy, you relate with it in a different way. I feel empowered, even though my patient is struggling in victim energy and hopelessness. I am in well-being. That is the greatest service that you can bring to anyone in your life, especially in your practice. So, and that's also why elite athletes use this. They go and they see themselves winning. What are they doing? They're feeling it. They're integrating it into their nervous system, into their brain. Every cell in their body works differently. And then they just, and they easily, slam the ball exactly where they want it to go because they've practiced in their nervous system. They've practiced in their chemistry. They've practiced it at the cellular level. That's how closely your body is listening to all of your thoughts and emotions. So I had learned this. I was at Grady doing a rotation in orthopedics. And there was this elderly African-American man. Most of the population was African-American. We're in inner city in Atlanta. And he was about 70 years old. He maybe looked a little older than that. And he, everyone had told me, this guy comes into the clinic all the time. Don't give him any more narcotics. He comes in, and all he wants to get is narcotics. Now, most of the days we're on this rotation, they're mostly, it was mostly men who were in ortho. All the women who were in there were, tough as nails. And it was like this boys' club. And so my friend Carrie and I were both the 2 ER interns rotating on ortho that month, and we decided, all right, we're gonna be tough too. We're gonna do this. So it was like this big contest in clinic. Who could get through the most patients? Because it's like, all right, we're gonna all team up and we're gonna clean out this clinic. And people would line up in droves. You didn't even want to go out and look at the waiting room before you started the clinic. You're just like, I'm just going to move it through and keep going, and someday we'll get done and be able to eat. But people would come because they needed so much. They had so much pain. And so they would come here, really not a great place where they were going to get that relief they were seeking, but hey, at least give me some medication and get me out of this pain. So this one particular guy went. And the crazy thing about this day was it was kind of toward the end of the morning, and the clinic was actually getting emptied pretty quickly. So I didn't have that level of rush. Now, I was still in my fight or flight of kind of do the thing and check the box and get them out, and there you go. And somehow that was a win. And this guy, I couldn't do that. He told me his sad story about all the years of pain. And the hip was bothering me, and they did x-rays, and they did an MRI, and no one can find anything wrong, and I don't want you to just give me more medication and push me out the door, doc. Please, just listen to me. Please, just help me. And in this one little flicker of a moment, I did this whole little and computed like, Kim, you really don't have anywhere you need to get right now, and you really could just spend some time with this patient, and you really should do that. And by the way, you have this osteopathic manipulation thing, and you really could do that too. And he must have felt that because he kept going. And he said, I really want you to just hear me. I know there's something wrong. He said, I've been trying to tell all these doctors for years and years, doc, and nobody's listening. And he looked me right in the eye, and now I'm like, okay, I'm here. And I could feel my nervous system just go, barriers down. And he looked right at me and he said, it's like they take the care out of you. And that's when I realized, I've been in this fight or flight, make it happen. Where's the care? Where am I present? Where can I make a difference? That's why he's come back again and again and again to try to get help that hasn't really been there. So I listened to him, and what I experienced was amazing, because as I got out of fight or flight And as I got present, I had one of my greatest mentors, Donald Hankinson, tell me, if you treat your patient like you have 5 minutes, it will take you all day. If you treat your patient like you have all day, it will take you 5 minutes. And that's the magic of what I experienced in this moment. When I showed up this way, I did this, I said, oh, let me have a look. Let's, I know this other manipulation treatment thing. Let me just feel what's going on. And I held on to his SI joint, tweaked it, moved it around a little, did a little SI joint release. You won't believe what happened. He not only had released the pain, felt better, but all of a sudden he said, there's this one time before this pain all started, and I stepped off the curve and I jammed right into my hip. And all these years the doctors have been asking me, did you have a trauma? Did you have a fall? Did somebody hurt you? And no. I didn't even think of this. But all of a sudden I remember exactly when I started having this pain, and that's what it was. And the release I had done was I felt like his hip was a little jammed up and the SI joint was stuck. And I just did this little myofascial release and released it. He had no more pain. He didn't need a prescription. He walked out of the clinic, but he gave me, with tears, he gave me a hug. He said, thank you so much. He wasn't thanking me for doing this manipulation or just getting him out of pain. He was thanking me for being present with him, for stopping, for caring, for listening. That's what they need. And so how many times have you done a little manipulation and they don't get any better? And the tissues still tighten up and it's just not going to let go, and then you try something else and you get fancier. Or maybe you go in a workshop and you learn 10 more things and you do these treatments and nothing happens. Why? You haven't entered the energy field, just like Einstein tells us. The problem can't be solved at the same level of consciousness where it's created. You have to enter a higher level. That's what the care is, right? You open yourself, you open your body, you're willing to be present, you're out of fight or flight, and guess what happens? It affects everything around you. Their tissue softens, it releases. You do the tiniest little manipulation and poof, the whole body unwinds. It's like this magic of the body, but that's where it comes from. So what happens when we live in fight or flight? We're altering the field we're in. Everything around you is responding to your energy field. If you have high cortisol levels, how many when you're a kid, if your mom was in a bad mood, you knew, like, oh, let me stay, or your dad, I'm not going near. You just know because we are naturally energy sensitive. And when you're a kid, no one told you not to be. No one told you you don't know. No one told you to ignore that because it's crazy. So you used it very intuitively. And I'm gonna ask for this special permission, but not right now. I'm gonna wait till mom's in a good mood, and you knew. But what happens is we learn over and over, oh no, mom's fine, I'm fine, everything's good. And you go, oh, I must be wrong. So you turn off your inner awareness and you start to go into your mind of calculation. Well, she said she's good and she has a smile, so I must be wrong. This is what it is. And then we do our life from that space. We can't help our patients. They're not open for healing. So you're aware of the energy of everything around you, and now you can start to open back up to that awareness and use it. Your patients are too. And so you enter the room and they immediately know, am I going to go here? Am I not going to go here? If you're open and you have an energy field of non-judgment, if you're open to that you care, if you're relaxed in your body and you're not in your own fight or flight, you can be of immense service to them because they'll feel it. I've had patients start to tell me things, not only that they never told another doctor or that they never told anyone, but that they never even told themselves. An abuse that happened when they were 3 years old, or sexual abuse, and they're like, I've always known this, but I've never really admitted it, never really let myself know this. And what you see, just like I said with Dr. Tudor Marinescu, that they will share with you the real core of what's going on, but that if you keep holding the space of presence, you don't contract around your own fear of the intensity you're meeting, that you will witness that healing because their body can heal itself. They're connected with source energy just like you're connected with source energy, and they can open to receive it So it comes in and makes those physiological, chemical, neurologic changes that allow their body to heal, sometimes instantly. So I want to talk a little about the osteopathic principles. They're very intuitive. It's not any rocket science, and I think it really goes along with functional medicine and with chiropractic, and a little bit about what heals us. And first, my story. And Peter, please keep me posted on the time. I ended up, third year of medical school, completely falling apart, and my immune system shut down, and I had migraine headaches. I was getting sick very, very frequently. I felt like I had the flu all the time. I was always exhausted. I started to get bloated. I had severe joint pain, musculoskeletal pain. I felt like crap. And it was a little on and off, where I'd think I was getting better, and then I'd crash again. I had no idea what was happening. And of course, I saw like every doctor imaginable. I was at the medical school, so we're doctors all the time. We had the clinic there, but then being from Boston, it's like every Harvard-trained physician. I'd been evaluated by like the best of the best. Didn't have a functional medicine doctor, which was a blessing because of what happened. I finally went to this infectious disease doctor, and he said, I know what you have. You have allergies. I've seen this. My daughter has it. She feels like crap all the time. You need to go to this allergist. And so I went to the allergist, and they injected me up, down, left, and right with every, horse dander and dust mites and like fill in the blank. And I reacted to all of it. Well, there's your diagnosis. You have allergies and some weird form of late onset juvenile rheumatoid arthritis. And then I needed to use all these medications, and I couldn't have rugs in my room, and I couldn't have curtains, and I needed special cleaning solutions, and blah, 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 blah. And my head started to spin. And you'll never run again. And just before I turned into a puddle of like devastated tears, I said, wait a minute, Kim, this is not even true. You don't need to believe this. And wait a minute, why are you reacting to all of these items, and why are you so inflamed? Because when they tell you you have allergies, it's this idea that like, this is my state, this is who I am, this is how I am, and this is what I have to deal with. But I knew that wasn't true. Energy is constantly changing. It's constantly moving. So what's happening in my body that's creating all of this inflammation? And that's when everything changed. And I developed a new conversation with my body. So instead of fighting the disease, or like every time I was aware of being tired, oh my God, I'm so mad, or I'm scared, am I gonna be able to do what I wanna do? Every time I was aware of my pain, that same reaction would get triggered. Well, all of your emotions are chemical states, they're neurologic states. And those limiting neurologic states damage the body and prevent healing. So if every time you're aware of your pain, instead of just being pain, it's fear, overwhelm, anger, frustration. Guess what happens? You can't heal that pain. And this is what I've seen for virtually every patient in my practice. And this is why when we release the emotional states holding back healing, I've seen them heal sometimes instantly. Had a patient with decades of chronic severe back pain. He'd gone to every doctor and holistic healer and nutritionist and acupuncture, Reiki, nothing, zero. And we did 4 minutes of MindBody medicine and released all this emotional heaviness, and he was better immediately. 4 minutes, and we got him off narcotics. Because we can enter those higher states of vibrance, vitality, joy. Those are states of energy. They're states of consciousness. If we can let them in, we can experience healing. How many have ever had pain? You go to the doctor and there's pain. You're gonna feel some very severe pain, and then it's gonna be over, and I'm gonna give you the shot, and it's gonna help you, heal forever. And you're like, okay, bring it on. And does the pain bother you? No. Because you know why you're having it, you know what it is, you know when it's going to end. But patients in chronic pain, this is where I was. I had no idea why I was having it. I had no idea what was really going on inside my body, and I had no idea when it was going to end. And we've all seen in so many studies what that creates. The stress state, cortisol, inflammation, adrenaline, and you live in fight or flight. You can't heal the pain when you're in that chemical state. So what if we can release that energy, and now you just have pain? okay, I got this pain. You can heal it very quickly. So I had this breakthrough. For me, it was more about that internal communication. I finally stopped trying to fight the problem. And knowing your body heals itself, your mind and body are connected, blah, 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 blah. I was like really trying to use that. Okay, so somehow I'm creating this. I got to stop creating it. What am I doing? Should I do something else? Oh, come on, Kim, you can be better than that. I had this whole internal fight. That's where I see 90% of the patients I see with autoimmune illness, that's why they don't get better. It's because they're fighting the disease, they're fighting the problems, they're fighting the symptoms, they're fighting their body. If you fight your body, you both lose. And so that's what changed for me, as I was like, okay, body, you're up to something. I have no freaking clue what it is, but I'm on board. What do you need? And I stopped fighting. In 10 days, I had no more symptoms, no more illness. My labs returned to normal. I needed no medications, no supplements, no physical therapy, whatever. I had no more illness. So osteopathic medicine is really about how the mind and body are connected. Every thought you have, we know now, right? This is over 100 years ago. Every thought is a chemical reaction in your body. And now we know that your neurotransmitters affect your heart, affect your kidneys, affect your hormones. They affect every cell in your body. It's not just your brain is separate. It's intimately connected with everything going on. So every thought, every feeling, every perspective, judgment, belief, conclusion creates your physical internal state. This is why what I do is help people get rid of all their conclusions and all their judgments so they're no longer living in that box and they can expand. And what happens with expansion? It's growth. We talked about before, growth allows healing. It's a freedom state. So that's kind of the first piece. The body has the capacity to heal itself. That's the second tenet in osteopathic medicine. And these were so revolutionary. In 1874, Dr. A.T. Still, who is a very prominent physician, just realized, like, we need to do more. We need to do better. There's more that's possible here. And he came out with these tenets, and he was completely ostracized by the medical community. So what's happening is still happening, right? Like, don't think outside the box. That's not possible. But he had some wisdom and some awareness, so he shared it. Structure precedes function. In chiropractic, this is a huge piece. Your body's only going to physiologically function the way, according to how good the structure is, how well balanced, how well aligned. Your alignment has everything to do, and we saw that in the beginning. If you're leaning back and it engages your body, you cut off life force. You cut off connection. And that rational medical treatment is based on these principles. That's why we're all here. We know we are all committed to rational medical treatment. Wait, I need to consider what I know. I know there's more to this equation. I know it's not just about A plus B equals C or what I can learn in the books or what I can prove in a pharmaceutical study, that there's so much more to the human body that I want to incorporate into my practice. So what happens in the conventional approach is we're looking at the tip of the iceberg. We have these physical symptoms, and then there's the whole world of the mental and emotional. Now, all of it is energy, but we're omitting a huge part of what we really are, what we're really made of, and how that works. So the way I look at this, and of course in functional medicine, we're working down here, not in the mental and emotional, but in the underneath the tip of the iceberg. We're getting below, we're getting into the root causes. We're looking at what's really going on physiologically and chemically. That is what's happening mentally and emotionally. So this is sort of the way I've helped to put together that perspective. You have what's happening down here in the bottom, which is our mental, your thoughts, your beliefs, your ideas. I hate my body. I really shouldn't have a body. My thighs are too fat. A lot of women have those kinds of body issues. And then there's, I need to work harder. Money's not easy to come by. Life is hard. You should work hard, and that means you're a good person. I should be giving back and doing for others and completely neglecting myself. And a lot of people have that perspective, like, I shouldn't really get my needs met. And these are societal. These can be from your family. So I'm not good enough. This is a huge one that creates those stubborn physiologic states that never heal. I'm not good enough. I don't deserve. I don't love myself. Even people actually have the record playing of I hate my body. It's totally crazy, but for so many of us, there's shame, there's fear, there's anger, and these things aren't always apparent in our own lifetimes, in our own experience. They can be downloaded from our parents. So if you had a mother who always sacrificing herself and doing for others, you learn through osmosis, you learn through observing, you learn through energy. So she may have never told you to deny yourself and give to your husband or your children, but you learn it because it's an energy download. It goes right into your cells. That's the epigenome. This creates what happens emotionally. How we feel emotionally is dependent on the thoughts we're having, because our thoughts are chemical reactions. So close your eyes for just a moment and take a slow, deep breath. You gotta breathe slowly into your belly to help you connect with your body better. Relax your shoulders. And then I want you to have the thoughts of, wow, there's a lot to do in my practice. I will never get all this done. I will never make it. I'll never figure it out. My patients are so complicated. Clearly, I need to learn more and do more and know more and be better. Life is so hard. And just allow yourself for a moment to feel how your body responds to those thoughts. Okay, and then let that go, shake it off, erase the board. And I want you to connect in your body and think these thoughts. I'm always expanding and growing. New possibilities easily enter my life. I can relax and receive. My body's wisdom is infinite and has so many gifts for me. It's okay to let go and receive life. Okay, and then just feel how your body responds emotionally, chemically, to those thoughts. And then you can open your eyes. Okay, so what did you feel? Relaxation, relief, tingling. And what did you feel the first set? The beliefs that were more limiting?
You could just feel something lifting, because the first thought's very oppressive.
The first thoughts were very oppressive, very oppressive.
There's a weight, I call it a mental helmet.
A mental helmet.
There's people, it puts a mental helmet on, so that just pushes everything there. But then after, you could feel the release. It's like a valve being open.
Yes.
And the whole, the tingly sensation is just a relaxation.
Yes. Awesome. Thank you. Anybody else?
Well, I felt like capturing flows and stress, it's blocking me at first and then let it go.
Yeah.
And just, making more space for doing, panicking.
Yes. Good. So closed and stressed and contracted, and then more of an expansion. Anybody else have any other pieces? So this is how our mental affects our emotional. It directly and immediately translates into a chemical state, into a brain pattern. And then our physical body, which is at the top here, responds to that. The muscles clench down. Well, guess what's happening to your adrenals? Guess what's happening to your blood pressure, to your heart rate, to every cell, every molecule in your body? You're going into contraction. You're going into that state of illness, aging, inflammation. Everything we know underlies every chronic illness known to man. And guess what's happening to your DNA? So we can try to approach our patients at that level while they're in that state with those records playing, with a mental helmet on, and we could throw all the supplements at the world at them. But guess what happens? You can't even digest the healthiest organic food when you're in that contracted state, because in fight or flight, you shunt blood away from the gut. So, and you actually activate parts of the brain that keep you in that alert, craving, and it's a self-destructive pattern. So you tell them, hey, eat this way, and they're like, I can't do it. You got to look at this first. And it's infinitely easier than you could imagine, because it starts in your body. You're actually inviting them into a higher state of consciousness, and their body already knows how to release everything that's in the way, everything that's preventing that. So, how many went last night to the, Dr. Peter's office and have the party? when you enter the space, and if you're an energy sensitive person, you can feel the difference if you enter, you're in a hotel room versus you're in this beautiful space of the office. And when you walk through, you can feel the energy. Now, they didn't go and set up energy grids and pray in the space or any of that, I don't think. But what happens? How does that happen? They show up to work every day with love. Love for each other. So husband and wife who love each other working in the space. Love for their team, their staff. Love for the business. Love for themselves, and that's an energy. It's a harmonic energy. So when people step into the space, they actually enter a different energy field, and it affects their health, it affects their body. It changes what's possible for them when they're with Dr. Osborne from what's possible for them when they're with another doctor. I had a patient last week tell me that one of her doctors, she had cancer, and she's relieving that. She did amazing in the last couple of weeks, having more joy than she's ever felt in her life and feeling in harmony. All of her pain's gone from the tumors. And one thing that she told me, she realized, she said, one of my doctors, way before I developed the colon cancer, I had a melanoma. And he looked in my eye and told me, well, we removed the melanoma and everything looks okay, but you just have to know that your body is always going to want to create cancer. That's just what your body's going to do. And she said, I never thought of it again, but I can tell you how angry that I actually have been all this time at that doctor. And so these weird little miracles will happen when people start working with me because they get into a different energy field. She said, I went back to this clinic and I was seeing a different doctor. And that other doctor, who doesn't even work there anymore, happened to be there that day. And I walked by him in the hall, and he looked right at me, and she said it brought all of this up to a head, that I felt all the anger, and I was aware of everything that happened, and I had that memory, and I did the tool that you told me to release the energy, and I feel completely free. And it's just like we had someone here say, when I first really connected with my body, all of the tension of worrying about work and worrying about the patient I haven't been able to help got so much louder and so much more intense. And what we do in those moments is we distract, or we go and work, or we, go and eat something, and you don't want to feel those emotions. But that's the moment of healing. That is the moment of healing, is when it comes all up to your consciousness, you got to feel it to heal it. And so you were able to release that energy because you brought it up to the surface. Like if you shake up a jar with dirt on the bottom, it's clean water with all this yucky dirt on the bottom, and it looks really good. And that's how most of us go through life. And we have like this much clean water and this much dirt. Until we accumulate that dirt. And then if you shake it up, it's all dirt. The dirt is everywhere, and it's all muddy and gucky, and you're like, oh, my life stinks. But that's what happens, is now it's all available to be cleared. You have to integrate it before you can release it. And so that's what happened for her. She had the gift of connecting with that doctor and really having it all come to the surface. She didn't have a conversation with him, but she was able to release it. Now, you gotta know, when she's in that doctor's office, in that doctor's energy field, with his judgments, conclusions, beliefs, and the ideas of what's possible, she's in a dramatically different energy field than when she's over here with Dr. Osborne, who knows what's possible, who lives with his heart open, who's present to know who he is, be aligned with his purpose, release everything that's in the way of that, right? Like you've grown. Old judgments or insecurities, or, oh my gosh, how can I do this? Or I gotta ask for money, and I gotta do this business thing. And to release that. Every speaker here has talked about that journey, so that you can really embody the truth of who you are. And that's what's happened for my patient with cancer. Why did she have cancer? Because of these stress states. We already know that. Why was she in these stress states? Well, she's been living her whole life apologizing for who she is. Oh, I'm not gonna make too much noise. Really, everything's okay. Okay. And her body got sick. Well, when she saw me, the cancer had just come back. And then she had to have this surgery, and we went through the whole thing of, we're going to do what we need to do so your body doesn't keep creating cancer cells. What does it need? What it needed, what we all need, it's to allow more life force to flow through the body. That's what heals the body. What did it take for her? She needed to start to stand for who she is, to speak the truth, of how she really feels, what she really thinks, what's real. Your body's going to tell you in every moment. You don't have to think about it, because we'll never figure out, well, let me think, who am I? What are the traits and characteristics that describe me? Well, that's not right. No, it's an organic expression of our truth in every moment. So she was at the hospital last week, and they took out the tumors. And they had told her, we're probably going to have to resect your colon. You might have a, colostomy bag, and we're, thinking that's the route it's going to go. And what we did was we communicated with her body to have the best outcome possible, to have the toxic cells be resorbed to the highest level possible, and have all the negativity and all the limitation and all the old judgments, conclusions, traumas, experiences get concentrated into those cells so they could be released with her body. And that sounds a little crazy in the realm of what most people practice medicine, but I know people who have actually healed that way. Mary Morrissey is a great example. She was going to die, and they said, we got to take this kidney. And the day before they were taking her kidney, they said, you have the disease in the other kidney too. We're going to take your first kidney, but you're still going to die. And this nun came to her bedside and said, would you be willing to help, to collaborate with me to do a healing for your body? And we can heal all this energy, and you don't need to remove your kidney. And she said, well, no, we got to get this kidney out. Well, how about if we do a healing so all the toxicity from the other kidney goes into that first kidney and gets removed out of your body, and you're completely well after the surgery? She said, yes, I'd be open for that. And that's exactly what she did. They removed the kidney, they looked at her kidney function, and it was completely normal, no more disease. And there are so many more stories exactly like that than you might imagine. So I did this work with my patient, okay? So it takes a little courage, and she was all on board. And one of the things that happened, they did not need to have a colostomy bag. Her colon was working very well. But 6 days after the surgery, they weren't able to start feeding her. They said, well, we're pulling fluid back from your NG tube, and there isn't enough acid. So you're not digesting. We need to continue, to give you intravenous fluids. And after 6 days, they said, you know what, we're going to need to put a line in your arm and give you food intravenously. And this is how different she is now. This is the movement. This is like life setting up the magic moment from who she used to be then, right? Okay, whatever you need to do, I'll just go along with it. That's fine. And that's not what she did. She said, she was at an academic hospital. She said, I have some of the world's best minds at my bedside right now. Think outside the box, because I am not allowing you to feed me through the vein. Period, the end. And what happened? They took another x-ray. So one of them decided, well, okay, this is our they told her, this is our protocol, this is our algorithm, this is the next step. And she said, dump your protocols, dump your algorithms, and go beyond the box for me. This is what is required. How'd she do that? She listened to her awareness, because we connected her with it. She knew. One of them decided to take another x-ray, and they realized that the NG tube had been inserted 15 centimeters too far in. So it's like in the duodenum. They're not getting any acid there. They pull it back 15 centimeters, suck out some fluid. She's perfectly acidic, pulled the tube and started feeding her. And she went home. And when she relayed the story to me, that's what we anchored in, was who was speaking. Who were you being? This new person, the one who stands for herself? Respect other people. It's not about, I'm gonna, hear me roar, but to speak from a space of empowerment. What chemical state does that create? What neurologic patterns does that create? Empowerment. It creates health. You're not creating cancer. And so she'd come to a greater completion of that healing process. Because we've all seen, if you stay in that same chemical state, which is how your mind patterns, perspectives, ideas, judgments, conclusions, memories feed into and create your emotions, that always creates a physical change. So I want to finish with a couple more. I don't know what time I have right now, but I'm sure it's not too long. in the Institute of Heart Math, how many of you heard of Institute of Heart Math? Profound things that they're doing with looking at how emotions affect our physical state, affect our physiology, our blood pressure, our heart rate. When you are in the emotions of anger, frustration, fear, rage, it changes the way your heart's pumping. You have increased heart rate variability. Your heart's more irritable. It's not as steady. It changes the way your heart rate is connected and flowing with your blood pressure, how those are relating. So you can be in physiologic harmony, what they call concordance. It changes the way you're breathing. You breathe more erratically, so things get disjointed. And I've used this in the ER, right? Chest pain, shortness of breath, anxiety, I can't breathe. Oh my gosh, this woman is having a PE. Let's do the gazillion-dollar workup and admit her to the hospital. Is it an MI? I don't know. I did some EFT meridian tapping with her. What's this? To get her into a different emotional state. In 3 minutes, crying, tears, my husband's leaving me, I'm scared, I don't know what I'm gonna do, and everything came flooding out, okay? But I stayed present with her, which is one of the most challenging things to do when people actually really go there, like the intensity of it can scare us. No more chest pain, no more shortness of breath, no more tachycardia. It was kind of cool because most of my patients I'm doing this work with are not hooked up on a cardiac monitor. She was. Oxygen saturation improved. 0 symptoms. And you better believe I did not do the $1 million workup and admit her to the hospital. I got some cardiac enzymes, got a chest x-ray. Most doctors, they follow the algorithm. Right? Person comes in, chest pain, shortness of breath, tachycardia. She was like 120, went down to 85 in minutes because we got her in a new emotional state. Your emotions inform your physical. When you're in joy, freedom, ease, abundance, happiness, which isn't really an emotional state. It's also a judgment because how long is that going to last until you make a new conclusion? When you're in those emotional states, your heart rate flows smoothly, your blood pressure normalizes, your breathing rate is harmonic with your physiologic function. Everything changes. Your emotions are a chemical state. They inform your physical cells. So if you're pushing the rock uphill, trying to do all the things you might want to do in your practice, but you haven't created an environment in which the patient can actually heal, you want to start with your body. So mirror neuron effect, a lot of people have heard about that. Your body has 3 main functions. It's a receptor. You're receiving information from everywhere around you. And I'm going to start training you into how to develop that, how to tune into that. You can receive infinite amounts of information. If you're in fight or flight, the information you're receiving is, what is the threat? What do I have to be scared about? What could go wrong in my life? And what happens? You stay in fight or flight, and you react to those things, so you create more reasons to be in fight or flight, because your body's a receptor, and it's receiving infinite amounts of information. Now, you decide, you key into turning the dial into what kind of information you're receiving. So if you ask your body, just like I was sick, right? What's wrong with me? What's wrong with me? What's wrong with me? What's wrong with me? Oh my gosh, what am I doing wrong? What am I doing wrong? And it took 1.5 years of no change. And then I started to ask different questions. Why is my body so vibrantly healthy? Why do I feel so amazing? Why am I filled with gratitude and joy? And then your mind can go, you can't have gratitude and joy. Everything's clearly going wrong. You need to do something. And then you just put that conclusion on hold. That's an interesting point of view. And you stay present in your body and you ask again, why am I so vibrantly healthy? Why am I so filled with joy? Other speakers on the stage we're talking about, we have infinitely more wealth, no matter what your financial situation is, than most every person on the planet, like the top 1%, higher than that in this room, but we could still live in lack. So is it the truth? Is it real? Oh yeah, it's real. I owe this much money to the IRS, and then my business has this thing. Or is it a delusion that we're fabricating and buying into and making more real? So your body has this receptive ability, and you can start asking questions about your patient. Now, how many of you put your hand on your patient, you get all kinds of information? You know, maybe where the broken bones are, or what's going on in their adrenals, or what's happening in the tension in their back. Like everybody, right? Well, it's not that weird then to allow information to come in without putting your hand on them. I was speaking with someone last night, one of the other doctors, about when I first learned this. You know, I was in second year of osteopathic medical school, and we did these clinical exams. So you're learning about the thoracic spine and the lesions and how things twist and turn and what can go wrong. And I put my hands on my partner, and you're not really graded on do you get the lesion right, but just what you know from the book. Did you learn it the right way and name it the right way and the treatment you would do? But this one particular teacher, Gretchen Sibley, she wanted us to go further. So I put my hands on my patient's back, and I went back to this one spot. And I'm like, I don't know. Put my hands on her back, and I went up and I'm playing around. I don't know. So I put my hands up and down. I'm like, okay, I'm not really finding any lesions, but if she did have one, it would be, let's just say she has T5 rotated left, side bent left. And Dr. Sibley she moves over and puts her hands on the patient. She goes, Kim, 3 times you went back to that exact same spot, and then you said, you don't know, and then you named exactly the lesion that she has in her back. And I was like, oh my gosh, I know something that I wasn't willing to know. I received information in my body that registered in my awareness that my conscious mind booted out. And we're doing that all the time. So it's the same thing. Would I allow myself to know something without putting my hands on the patient? Well, that's not so far of a jump for us, right? Because we've already allowed our minds to be much more expansive than most people. So what if I want to know, how's my child doing in this moment? Most moms already do this. Very intuitive. You're expanding your field of awareness out beyond your body, and you're asking questions. What is it my patient really needs in this moment? What will serve this person most? And you don't have to answer the question, because the only way you could do that is from your mind. Judgment, calculation, conclusion. And your mind is so limited. You've only lived this one lifetime that you have accumulated the knowledge, and you haven't really read all the books. It's never going to happen. You want to ask from your awareness and receive from your awareness. I wonder what would serve my patient best in this moment. Because that will automatically guide your choices, your words, your treatments, everything you do, if you ask the question and receive. The second thing is that your body's a transmitter. So just like when you're a kid and like, oh my gosh, I'm not gonna go near dad right now, let me go over here. Your patient knows what judgments and conclusions you're holding in your body. So if they come to you, and I remember Lissa Rankin had a great story about this. She showed up for work. She was already so dissatisfied in her obstetrics practice, but she went into the room with this one woman, one foot in the door, one foot out the door, one foot on, hand on the chart, and one eye on the patient. Okay, great. Oh, so you're good. Okay, I'll see you later. And finished the appointment. And that patient wrote to her and said, I've been being abused by my husband. I can't live like this in my life anymore. I haven't been able to tell anyone. And that day I showed up for my appointment, I was intending to share it with you. But as soon as you came in the room, I felt like there's no way I'm going there. I can't go there. There's not the space for it. And so I didn't. And now I still don't know what to do. And when she got that letter, she's like, now I know. I've been thinking about doing something else with my practice. Now I know I have to, because I've been living in this fight or flight world of medicine, and I want to practice differently, and my patients want me to practice. Do they need me to practice differently? So you are constantly transmitting your state to them. They know what they can and can't share with you. It isn't conscious. For some of them it is, like this person. For most of them it's not. They'll just naturally be more aware of what's really going on inside them. They all know. Every time I do treatments and we're on a Skype session, all my work's online. Everything I'm saying to them, because they're repatterning what's going on, they're talking to their body in a new way, and they'll go, oh my God, how did you know that? That's exactly what I've been telling myself. That's exactly what I've been thinking. That's exactly how I've been feeling. It's in their energy field. So they are aware of it, but they weren't consciously allowing themselves to have that awareness. But they allowed me to have it, so I just fed it right back to them. We all have this ability. So as a transmitter, what are you transmitting to your patient? What do you want to be transmitting to your patient? Do you want to be transmitting, I love and accept you fully. I'm here for you. I'm willing to go through fear and be strong. Through your fear, through my fear. And let's see what shows up. And let's open to new possibilities. That's what they need. And then the last piece is you're a transformer. We transmute energy in our body. You're a transmuter, a transformer. Your body, just like we did the exercise here. There's anger, frustration, fear. Oh my gosh, every time I think of this situation or this patient I can't fix, I feel this heaviness. And then I move that energy. How did I do that? Your body is a transformer. Okay, we're going to skip a little bit here. Anybody ever have heard of Dr. Emoto with his research? Okay, so they look at water under, it's really popular, right? But hasn't been integrated into mainstream medicine. It's like, we can't omit this. It's malpractice to pretend things can't be done when we have this research. And we have case after case of these spontaneous miracle healings that we now do have the science to describe, so we can repeat it. So he looked at water under the electron microscope. And there'd be water that, had been preyed on by Tibetan monks, or water that had gone drained through a sewage system. And there was a vastly different pattern, not just like there's dirt in the water, but actually looking at that water molecule under the electron microscope. And there'd be these crystals, they'd freeze it, and there'd be these crystals of these beautiful harmonic patterns of the water that had been preyed on with the essence of I love you, and a different pattern if it had been preyed on with the essence of thank you. Slightly different, but still really beautiful. And then they'd look over here, these, different colors and ugliness and disorganized crystals of the water that had a label on it, I hate you, I hope you die, or that had gone and been drained through a sewage system. Water is affected by the energy around us, and your body's made mostly of water. So it's just one more example to show, your cells are energy, and they are affected by energy. And so we're not looking at trying to change your liver cell into a cat, right? Where this is like, oh my God, this is such a transformation. I can't even imagine having this impact on my patient. They have a cancerous liver, and they'll never get better. And this is what the studies show. And they can't heal. I mean, this is bad. This is like stage 4 metastatic cancer. And you have that point of view. Conclusions, judgments, beliefs. We're not talking about trying to turn your liver cell into a cat. It's to turn a diseased cell into a healthy cell. It's really not that much of a jump. And we've seen this again and again and again, where patients given weeks to live, stage 4 metastatic cancer, spontaneous remission and no tumors. How is that happening? We are opening our eyes to receive the reality that's right here. Everything is energy. We are in a field of energy, and we are a field of energy. You bring a field of energy to your practice every day. You bring a field of energy to your children. You bring a field of energy in every interaction you have. So how do you use your body to be the medicine? You are the medicine, first and foremost. I guarantee this will keep you out of fight or flight, because you can still use all those awesome modalities in your toolkit, but when you use them from this space of empowerment, there's nothing to fear. So when you're in your body, right, show up in your body, meet that fear, meet that pain, meet that whatever intensity it is, you have the ability to allow it to release. Because you don't heal yourself, and you don't fix yourself, and you don't release your emotions. You open to the energy that allows yourself to be healed. And it will heal you, and it will heal your patient, and it will heal your practice. All those things you think you got to figure out. I tried to do that for a couple years, doing this online thing, and I got a blog, and oh my gosh, 1,500 to 2,000 words, I don't know how to do that. And then I just let all of that go, and I said, you know what? I'm just going to stay in the flow of who I really am and let that inform everything I do. So it's great to learn those tools of how to do your blog and what's going to work the best out there, but don't think that that is the highest reality. It doesn't actually matter as much as you might make it matter. So stay aligned with who you are and let that flow in a video. Whether it's, we just had a speaker up here, right? And he admitted, like, wow, I'm really nervous. I'm new at this. Was it perfect, the best, talk you ever heard from a standpoint of, just looking at the movements or the tonality? No. Did it totally move the room? Could you feel his heart? It didn't matter. And it doesn't matter if he ever improves these little things. He was all heart and all passion. And that's what moves the room. And that's what has you like on the edge of your seat, going to listen or take action or do something. Your patients aren't non-compliant because they want to just buck what you're saying or that you haven't been convincing enough. It's because you haven't moved the energy that's in the way of them making a new choice. Okay, so I'm going to teach you my instant elevation technique, which is like the first key of getting out of fight or flight and shifting your brain patterns and shifting your chemistry. And this opens things up for yourself, but it also opens things up for everyone around you. So you bring your awareness into your body. We've done that a little. And I'm going to walk you through it in a minute. You shift and change your breathing. Because in fight or flight, you're breathing shallow breaths into your chest. And that's going to keep you revved up. You cannot let in new information. And then you make a new choice for, what am I really aligned with? Am I still going to keep trying to chase that result, or am I just going to get here now and choose to relax my body? That will always create more. Matt Sanford is kind of a famous MindBody yogi guy, and he had an accident a long time ago where he was paraplegic. He can't use his legs. So kind of crazy that he's now teaching people how to be in their body and do amazing yoga. Like the most elite yogis go to him for training and alignment and embodiment. And he said to me that one of the hardest things to do is stay present and sit in the space of someone's pain. He helps teach doctors to stay present and sit in the space of someone's pain. Because what do you do when someone shares their pain? Oh, and I've had 25 migraines a day, and I can't eat oranges, and I have all this anxiety, and my left ear itches, and everything gets so convoluted, your head is spinning, and you're like, oh, I'm never going to be able to fix this. And you're overwhelmed. Versus stay present. I'm going to teach you this tool because it allows you to just, I'm breathing in, I'm breathing out, and I'm staying in the field that allows us both to heal. Because I have my own fears about this. Wow, that's intense fear. And now I can respond instead of getting thrown into reaction that shuts down my energy field, messes up my chemistry. How many of you at the end of the day, you feel like you're taking on everyone's energy, and you go home with that energy, and they're like all fired up. And like years and years and years, it's like the wounded light worker. Now you're sick. Where did you buy into the delusion of their pain, of the truth of disease? If we keep buying into the delusion of chronic illness, we're all going to die. It isn't our natural state. And when we open to trust our natural state, everything heals. Everything heals. Okay, so take a minute and close your eyes. And you're going to learn what I call the instant elevation technique. It instantly elevates your state, your energy state, your consciousness, your well-being. Feel your spine nice and straight. Relax your shoulders. And just breathe slowly. Start by bringing your awareness into your body, into this small space of your body. So there's lots of stuff going on around you. Any part of your energy that's caught up in the past, previous memories, experiences, traumas, dramas, mistakes, being wronged, all of that creates anger or regret and resentment. So you can release that chalkboard of the past and just erase it and blow the chalk dust away. And then any part of your energy that was in it, just bring that right back here, right now, into the center of your head. Call it back in. It is part of you, and it is welcome in your body, and this is the place where it needs to reside. So bring it back. And take a deep breath. Any part of your energy that's floating off in the future. What might not happen, what might happen, what I hope happens, what I have to do, all the work I gotta get to do, all this stuff. And just release the chalkboard of the future. Just erase all of that. And then just blow away the chalk dust and let it all go. And then any of your energy, any part of that that is you, bring all of that energy right back here, right now, into your body in the center of your head. Call it back in, command it back in, allow it back in, invite it in, and now just be present in your body and bring this energy from your center of your head and all the way down through your neck into your heart. Good. And feeling the space around your heart. If you're breathing and you feel motion around your chest, bring your awareness to the space around your heart and let all of this energy pull itself way back down into your heart, into your body. Good. And then the third place is feel the space of your pelvis below your belly button. Breathe deeply into your abdomen. And then allow all that energy to come down from your heart, through your belly, past your belly button, all the way down into your pelvis. And just command it, open to it, allow it, see it, visualize it. And let this energy come all the way down into your pelvis, and then just feel the space of your pelvis. You can feel your bum on the seat. You can feel your hips. It's amazing how many of us don't bring our awareness to our body, especially this part of our body. And then so much energy and emotions get stored here that are creating our field and impacting and affecting our life. So just bring your awareness here. And whatever may come up is absolutely fine. The second piece is B, to shift your breathing. So begin to breathe fully and slowly into your belly. Relax your shoulders and let your belly balloon out with each inhale. See a red balloon ballooning out and expanding with each inhale, way down at your pelvis. And see it coming back in with the exhale. And if there's any discomfort, just release that. And then even release trying to breathe this way. Simply let go and visualize, see that red balloon expanding. Your body speaks in imagery, and so it will know exactly what muscles to relax, what muscles to use to allow this breathing pattern, this natural, fluid, harmonious breathing pattern. This brings you into the relaxation response. Let that balloon come out and let it sink in with the exhale. This is my natural state. Ease is my natural state. Let your body know. When you breathe this way, you're letting your body know. Ease is my natural state. It's okay to let go. You go into the relaxation response. Science has shown again and again, this allows healing. This is the process of healing, restoration, repletion. The third piece is to choose. Now, this may be you're doing this tool in the middle of an argument with a spouse, or you're doing it while you're on stage speaking, or you're doing it while you're in an interaction with a patient. And so you can make a different choice. I choose what is in my highest and best good. I choose what will contribute the most to us both right now. I choose my well-being and ease. You don't need to actually go to the mind to figure out what to do with that. You just make a choice. Your choice informs your body. Your choice informs your cells. All of our actions are guided by our emotions, by our state, not by our conscious decision and mind. So you don't need to even go there. Well, I choose abundance, but how? How will I do it? You're setting it up. You've called your attention back into your body. Your body only lives in the now. It can't live in the past. It can't live in the future. So you have access to your power because you have called your energy back into your body, which only lives in the now. That's where your power resides. You've shifted your breathing to make a change in your brain, a change in your chemistry, a change in your energy field, powerful change in your energy field. And now you do have access to more choice. So just allowing, receiving. I choose to create abundance in my life. I choose to affect every person I connect with today in the most positive way, the most expansive way that has them invite more than they ever imagined into their health and into their lives. I choose in this moment that every patient I've ever seen feels the impact of this love and joy I'm now receiving. I choose that from this moment forward, my life opens up in the most magical ways and everyone I connect with feels it. Okay, and then you can open your eyes when you're done. How was that? How did that feel? Good. Anybody notice anything specific? Everyone seemed pretty present with that. Everyone seemed pretty connected. So how will you bring this to your practice? You can do a daily alignment. You don't have to carry on the energy of your patients, but if you're present in your body, you won't even pick it up. So in between patients, you could just do a little energy clearing. Do that ABC tool, be present in your body, choose light, choose ease. You can start in the beginning of the day. Do that ABC tool. Make a choice for your day. What kind of energy do you want to command your cells to be in? You're informing them. What kind of energy field do you want to carry for today? An energy field that creates amazing possibilities, your patients hugging you, joyfully thanking you? You can create it. I also have a tool for you. How many are familiar with EFT meridian tapping? Great. I use it a lot, and it just gets people's mind out of the equation, all their judgments and conclusions and beliefs and resistances out of the equation so they can receive. So I have a tool called EFT Doctors, a little site you can go, and then it gives you a little video about how to start incorporating that into your practice and how to use it on yourself. And at drkimd.com, I send out, like twice a week, I send out a MindBody tool like the one we just did today. I send different ways of getting connected with your body and opening up to creating your life. So at drkimd.com, you can subscribe there. And at EFTdoctors.com is where I have the little video to learn how to use EFT in your practice. And I have been training clinicians, training people in healthcare who want to begin to incorporate this new level of their own awareness, of their own impact in their practice and for their patients. So you can reach out to me if you would like more support on that. And the most important thing is, stay out of your mind. We have all been trained to rely on our mind as if our mind is God, and nothing could be further from the truth. Your body is where you have access to that level of infinite wisdom, and you can always trust it. I've seen people heal from thyroid disease, autoimmune illness, chronic pain, cancer, MS, severe anxiety, get off all their medications. True miracles that I get to witness every day, and that's what's possible for us all. So get out of fight or flight, enter a healing energy field that you create, that you receive, and allow this to change your body, your practice, your business, and your patients. Thank you so much for being here. I'm so excited to have been able to offer this. If there are questions, I think we're probably short on time, but I welcome all of the questions that you have. You can just email me at drkim@drkimd.com, and I look forward to connecting with you.